Do you ever wonder, what is COVID-19? Are you left in a daze by the plethora of medical jargon surrounding COVID-19? Well, I, S.R. Ridley, have the solution for you in its simplest form. So, what is COVID-19? Well, according to the Center for Disease Control 2020, COVID-19 is an acronym that describes a group of lung diseases that are easily spread from person to person. So what's that? Now, COVID-19, the acronym actually stands for Coronavirus Disease 2019. Okay, so why is it so deadly? What makes COVID-19 such a virulent disease is because it causes a deadly type of pneumonia. So what is pneumonia? Pneumonia, in its simplest form, is just trapped fluid in the air sacs of the lungs. See, the lungs have balloon-like structures, which are air sacs. These air sacs are called alveoli. These air sacs, alveoli, allow for oxygen to get into the lungs and carbon dioxide, CO2, a waste product, to get out of the lungs. Now, this flow is very important. Without it, life, well, would just not exist. Yikes! We don't want that. The alveoli, the air sacs, are made up of rectangular cells. These rectangular cells have hair-like structures on top of them, called cilia. What makes COVID-19 so deadly for some people is that when this specific type of pneumonia trapped fluid develops, these hair-like structures are immediately, completely destroyed. So what's the problem? When this occurs, the fluid is trapped in the rectangular cells with no way of getting out. See, these hair-like structures, cilia, are very good at protecting the lungs, and without them, mucus and other unwanted debris cannot get out. Hence the phrase, trapped fluid. Here is an analogy. Imagine a balloon full of wet sand, submerged in water, and covered with small holes. Will water enter, or will sand leak out? The answer to both questions is no. The trapped fluid acts as the wet sand, not allowing oxygen in or CO2 out. So what's the problem? The triangle of death begins. So what's the problem? In the triangle of death, pneumonia, acute respiratory distress syndrome, ARDS, permanent scarring of the lung tissue, and low blood pressure, BP, occur. So what's the problem? If oxygen can't get in and CO2 cannot get out, you simply cannot breathe. And now you are on a ventilator. Life support officially begins, and life as you once knew it is over. So what's the real problem? Once the triangle of death begins, death usually happens in 48 to 72 hours. Hold up, wait a minute. There is a light at the end of the tunnel. So what's the solution? The solution lies within the pages of this book. So before you go, I, S.R. Ridley, a nurse you can trust, want to help you save a life and give this book to a friend so we all can heal. Remember, the current state of the world does not have to be the new normal. See you at Truth Hour, Healthcare Exposed. www.areyousafeintoday'ser.com